好多在職人士都承受唔少工作壓力。如果壓力過大而未有適當處理，就好容易出現負面情緒。壓力過大可能會影響睡眠作息、工作表現、人際關係同埋身體健康。點樣喺繁忙嘅工作中減壓，並且以樂觀嘅心態去迎接每一日嘅挑戰？遇上唔如意嘅事同壓力過大嗰陣，我哋可以同人傾訴，亦可以尋求專業人士協助。例如可以向公司為員工提供嘅僱員支援計劃求助，專業人士可以透過面談或者熱線作出輔導，協助員工處理壓力或者情緒困擾等問題。另外，以下方法亦都可以促進職場精神健康。喺辦公室定期提供健康資訊，加強員工對精神健康嘅認識同關注，推廣與人分享、正面思維以及享受生活三大元素。與人分享 sharing 表示同家人同朋友分享同幫助有需要嘅人。同事之間可以透過多讚美、鼓勵同關心嚟實踐與人分享，從而喺辦公室建立和諧氣氛同關愛文化。正面思維 mind 只保持開放思想，以積極態度同樂觀想法看待及處理事情。當面對壓力、改變或者逆境嗰陣，要保持正面思想，咁我哋迎接挑戰嗰陣就會更有能耐，享受生活 enjoyment， 代表參與自己享受而對健康有益嘅活動，以發揮潛能同獲得滿足感，好好享受生活，有助促進職場精神健康。僱主或者管理層亦可以為員工舉辦興趣班或者新技能學習班，例如瑜伽班、太極班、繪畫班同手工藝班等。喺機構內組織義工團隊參加義工活動，鼓勵同事之間多溝通，促進彼此嘅了解同關係，凝聚團隊，培養合作精神，例如組織團隊活動、舉辦員工生日會同親子活動等，鼓勵同事多發展興趣，有助培養正面情緒。最後緊貼我哋嘅健康資訊同推廣活動，想知更多關於健康生活嘅資訊，可以繼續留意好心情@健康工作間網站。
Good morning, everyone. I'm today's MC, Samantha. Welcome you all to today's webinar. Today's webinar will be conducted in English with Chinese simultaneous interpretation. Those who want to listen to the Cantonese translation, please press the Cantonese button.
In English, with Chinese interpretation provided simultaneously. For your desired language, simply select Cantonese or Chinese button. It's a great pleasure, Professor Dame Carol Black, to speak to us on the topic of post-pandemic reflections on workplace health, well-being, and productivity. Professor Black is the advisor of the UK government on combating drug misuse, which has led to a new 10-year anti-drug strategy. She was the UK National Director for Health and Work from 2006 to 2011, and has become an expert advisor for the government. Professor Black published 3 influential independent reviews on workers' health and well-being issues, which are pivotal to productivity and national policy. She was also the principal of Newham College at Cambridge University from 2012 to 2019. She has been an inspirational leader, mentor, and role model for physicians and public health professionals. We look forward to hearing her experiences and thoughts on how we can create safer and healthier workplace in the upcoming years. Please join me in giving her a very warm welcome. Thank you, and over to you, Professor Black.
I'm delighted to be in Hong Kong. It's some 4 years since I've been here in person, and it's wonderful to be back. And I'm very, very pleased to be able to share with you some reflections on the post-COVID period, taking my examples particularly from what is happening in the United Kingdom. So I want to take us back to 2005, because that was when the British government first published its strategy on health and well-being in the workplace. It was a very good document, and it had an excellent vision, as you can see there. They wanted health and well-being at working age to be given the attention it deserved. They wanted it to be promoting returns to work, and they wanted health not to adversely affected by work. And they wanted work to promote individual and overall health and well-being. And I think particularly important, they wanted people to make the right lifestyle choices from a very early age. What they considered to be success, I think, is very important. You can see what success should lead to on this slide, and it included increased productivity, people more effective at work, and they wanted to reduce health inequalities and social exclusion. And they were particularly concerned, and still are today, in making it clear that people with health problems or disabilities should be able, with support, to be in the workplace. We've been reflecting at home recently on how far we've come since that strategy was developed. And there are both good things, and there are both things which we haven't done quite so well. After that 2005 review, the government decided to have a National Director for Health and Work. And I was very fortunate because I was chosen to be that National Director. And so I wrote my first report for government, Working for a Healthier Tomorrow, which was published in 2008. Now, this review set out the first ever baseline for health of Britain's working age population. It showed that we were living longer, but not necessarily in good health. And therefore, what I wanted to do in my review was to identify those factors that stood in the way of good health and to suggest interventions, including changes in attitudes, behaviour and practice, as well as services that could help overcome them. Since 2005 and my review in 2008, we've had no lack of evidence or strategy, because from my review, the government then decided that it would look at the health and well-being of the staff of our NHS, which was the Borman Review of 2009. Unfortunately, that review came as we were changing governments, and in changing governments, unfortunately, the recommendations of that review did not go into practice. I then wrote 2 other reviews, one in 2012, one in 2016, both of which had recommendations which the government accepted. And then in 2017, we had a very important review on mental health at work, called Thriving at Work. Mental health at work has been going up the agenda ever since 2008. And then an equally important review by Matthew Taylor, which looked at the gig economy, workers who were working for themselves, who maybe did not have as much protection as those who were working for organisations. And then, of course, we had Michael Marmot, most concerned about health equity in England, reporting in both 2010 and 2020. So definitely we had much more government interest in this topic. From my own reviews, we had policy development and policy change. I've listed the important ones here, and I think some of the most important was that we got a new medical certificate. We used to have a sick note. Now we have a note that says, how fit are you to work? It's the change of approach and attitude. We developed a multi-professional health and work council. And very importantly, we started to do more research. And we developed a research collaboration which was funded by the Medical Research Council and an organisation called Versus Arthritis. And most importantly, we at last got a cross-government work and health unit, brought together health and the Department of Work and Pensions. And we also developed a very successful trial for addiction and return to work. So there were many developments. And before I go on to what has happened after COVID, I do want to acknowledge the positives in that period, 2008 to 2019. The government accepting reviews, initiating programs, very good stakeholder engagement, particularly from our businesses and other institutions, and a much bigger growing understanding that health and well-being in the workplace affects sickness absence, presenteeism, a word I don't particularly like, but meaning that you are at work but not able to give of your best. Staff turnover, are you engaged at work, and your productivity. There was a much greater attention to mental health and musculoskeletal problems and chronic conditions. And people started to talk about good work and healthy jobs and what should be the culture in a workplace. And also a much greater association that if you're born in poverty and have a poor education, you will most likely have worse health and your work opportunities may well be less. We've had an increasing amount of really evidence-based toolkits and guidance and training. And during that period, 2008 to 19, our workforce, our participation in the workforce, rose by 3 million. Now, much of that was due to those 50 plus, which was good because we had people well enough to work for longer. But there was the problem that there was a reduction in our young people going into work, but they were the positives. And then let me just add the negatives or the challenges. So politics, our changing government. We had a big period of austerity starting in about 2012. This led to whether initiatives could be sustainable, consistency of delivery. There's always resistance to change, which you have to deal with and overcome. And our research endeavors rather slowed down, and the use of workplace data was not as good as we would have liked it to have been. And then the real challenge of training enough GPs to really do a good fit note, and the real importance, the growing importance of a good line manager who knows how to manage people and is supported and trained to do that. One of the real challenges is we've had a rise of a well-being, wellness industry that is not based on evidence, and that is something which of course is a challenge if you're putting into place in the workplace things for which we either have no real evidence or that we haven't seen good practice. And in the United Kingdom, we've had to face ever-decreasing productivity. Just a word about productivity. It is, of course, a very complex issue. And over the past 15 years, despite great technological advances and upskilling of the workforce, productivity per worker has stagnated in many economies, and that, of course, includes the United Kingdom. And one thing that's often overlooked is that link between our physical and mental health and the well-being of employees and their productivity. That you could be at work, but not able to give of your best. And that means, over time, productivity will be reduced. There's a survey in the United Kingdom called Britain's Healthiest Workplace Survey. It is given and done through an educational grant from Vitality, and RAND Europe, a research organization, has been responsible for the analysis of the results. And it usually engages about 26,000 employees each year. And looking back at the figures from 2014 to 2019, just before COVID hit us, health-related productivity loss increased from 16 to 33 days per worker per year. And the main cause was not absenteeism, it was being at work but not able to give of your best. Thus, you really didn't need to start to work till the middle of February because 33 days had been lost. This was mainly driven by poor mental health, was absolutely top of the agenda, lack of good quality sleep or length of sleep, and then many employees with financial concerns that turned into poor mental health. And then with that background, where we had been beginning to make some considerable progress, although certainly we had challenges, COVID came. And what COVID did in the United Kingdom was fully expose that vital relationship between our economy and health. COVID, when it hit the United Kingdom, I regret to say, found a very fertile soil. We are a population of insufficiently healthy people. We have, sadly, high obesity rates, particularly worrying in children. We have lower physical activity than is desirable, and we still have many poor people living in deprived areas with all its consequences. And that's what I will call a poor soil met an NHS that was already overburdened and then became much more overburdened during COVID, and after COVID is really in a fairly fragile state. During that COVID period and afterwards, we lost 600,000 workers who dropped out of the workforce. Much of the progress that we made had been halted, or indeed, dare I say, deteriorated. And whichever aspect of mental health was measured in the UK population, it had diminished. Now, health, as we all know, is an asset. It's a capital stock, and it's really necessary to work. There's a certain level of health which, if you fall below, you can't be in the workplace. And it was and is still, at the moment, diminishing in the UK. This is taken from the Financial Times in October of last year. And what has worried our government particularly is you can see from this that we're the only developed country where working age inactivity rate has been rising after the initial pandemic shock. In many countries, gradually, and in some cases quite quickly, people have returned to work. But that has not been true for us, and we still have this challenge to deal with. So our unwanted labour market change, I've listed on this slide, a big increase in economic inactivity. And that's concentrated in our younger worker to start with. Some of those, of course, have chosen to stay on in education or go into further education because there wasn't really work for them to go into. But also, worryingly, in our 50-plus workers, those workers with experience who could mentor the young, who were really driving our economy, too many of them, 600,000 to be precise, have not gone back into the workplace. An analysis would suggest that's largely driven by long-term sickness, and that was beginning even before the pandemic. Unlike other developed countries, as I've suggested, we have been slow to go back to work, so we worry that we have a UK-specific factor. It isn't explained by long COVID, and neither can it be explained by people not going back to work because of caring responsibilities or retirement. Now, retirement is a very broad word, and it can mean a lot of things. It can mean you've got enough resources, you've had enough of work, you're going to give up, or it could mean that you're not well enough to work. So that word, we don't know always what lies underneath it. Some people said, well, home working might help close the participation gap. But actually, that is not true, because our long-term sickness is concentrated in our low-paid workers, and most of those need to be on site and can't actually work from home. So I've tried to summarize here the main workplace COVID changes, and you can see some of them actually are positive. It hasn't all been negative. Occupational health, which was often not a really appreciated specialty, and about only 50% of our workforce had ready access to it, has come to the forefront. Occupational health professionals were crucial in COVID to do risk assessments, to give really good advice within the workplace. And I very much hope that that will be retained as we move forward. Health and well-being became important in every workplace. Employers had to really think about it in a different way. They had to think about it for their home workers as well as the workers who were coming in. There was a much bigger investment in digital structure, and that, of course, was a good thing, and that changed remarkably quickly. We still have a big discussion in the United Kingdom about hybrid working, its pros, the flexibility, the freedom it gives, and the cons. That lack of social contact, that meeting in person, which might spark new ideas. Getting this balance right is still a challenge, and one that most companies are working on. I've mentioned economic inactivity and how we need our 50-plus workers to go back to work. Mental health has gone up the agenda in an enormous way, and it is well recognized now that the psychological safety of your workforce is truly important. And leaders have had to reimagine how they lead. They've had to become much more empathetic leaders. They've had to try and understand what happened in COVID, the fear that people had, the fact that they were at home not really terribly well necessarily, probably putting on weight, less active, returning to work, quite a big thing to do. So leaders have reimagined how they lead, and line managers are in the spotlight because they are the truly important people who build their teams. What extra support and training do they need? And then, certainly in the United Kingdom, the employee voice is stronger. Having been through COVID, people have been reassessing their lives. What do they want out of their lives? What do they want out of their employer? So that has been an important change. And we've recently had a large trial of trialing a 4-day working week. It's a trial that some would say did not have terribly good methodology, and we will need more than the positive result of this trial to say that it's a good thing. But I do want to give the idea that COVID did have some good positive things, even though itself it was a terrible event. Just to pick out one or two of those, occupational health. At last, our government understood what high-quality occupational health services could offer. They relied on them more. They consulted them more. And for the future, we require a better central government understanding and commitment to the need for occupational input, to strategic decision-making, both at a national level and more locally in our regions. And we need to see occupational health voice heard at the boardroom table. So often in organizations and companies, they're excluded from that table, but they can bring great depth and breadth of knowledge to support a healthy and a high-performing workforce. I just wanted to bring to you what had been happening in our National Health Service about a very large workforce, well over 1 million people. And before COVID, occupational health was there, but not really truly appreciated. But during COVID, we developed, and I chaired the advisory group that was doing this, we developed this new framework that you can see there. And at last, in that professional well-being support section, that is where occupational health now sits. Before, it was outside of the health and well-being culture. It's now absolutely in there with managers and leaders, fulfillment at work, relationships, etc. And we have a growing OH problem in the health service. And this program is there developing a highly professional, progressive, proactive service. So that was positive. The other positive thing that came out of, and during COVID indeed, we developed what we called mental health hubs. Because the mental health need was much greater, we had areas around the country in our hospitals, etc., where there was a place where you could discuss and get help for your mental health concerns. And finally, we developed the role of health and wellbeing guardians. And these are non-executives on the boards of our hospitals and NHS trusts, and they are there to bring to the board what is going on with the health and well-being of the staff of that institution. So the voice of health and well-being goes to the board through those non-exec health and wellbeing guardians. So over the 2 years of COVID, we were able to improve health and wellbeing of staff in our National Health Service. The trend in mental health has been vital. This is a survey by the organisation Mind. You can see it was still taken at the height of COVID, 2021, but it's a worldwide survey, about 1,500 human resource decision makers, and you can see how important mental health had become. Proactive mental health support, 98% was now a business priority. Improving what you could get online, digital mental health tools online, 85% of those surveyed said that is now important. Wellbeing champions in our businesses and organisations, and much more investment in mental health training. And the iOS 45003, first of its kind, global standard framework outlining how to manage and protect mental health at work. This was a really important initiative by our own health and safety executive, and that happened in November 2021. Before, the HSC hadn't really said very much about mental health, not in the way they've said it in this campaign, in which they've joined with Mind, one of our big charities. So they've acknowledged that workplace stress and poor mental health risk is becoming a health and safety crisis for the UK workplaces. And in 2020-21, more than 17 million working days were lost to stress, anxiety or depression. And the charity Mind suggested that the mental health of employees had worsened by 40% during the pandemic. So this campaign from our own regulatory body aims to help businesses recognise the signs of work-related stress and make tackling issues routine. They called for a cultural change across our workplaces to treat psychological risk as well as physical ones. They said employers should assess all workplace risk, not just physical safety, promoting an open environment. That was a big change and a most welcome change, supporting mental health in the workplace. And I've just chosen for you one of the headings. This is a 2023 heading from the Times, one of our broadsheet newspapers, which reported on the Times Health Commission and said, poor mental health is the main cause of long-term absence. So it has, as I've said, risen up the agenda and is now getting the attention it deserves. Hybrid working, lots of views on that. We'll never return to the office. It's time to admit that hybrid working is not working. So as you can see, a big debate about whether to work from home or not, which is a challenge that hasn't yet been sorted out. There are, of course, values of working from home, and I've listed some of them here. Encouraging more locally diverse job applications helps organisations to compete for workers. Workers can maximise their pay by working in areas with lower living costs, reducing their travel costs. It allows a much more diversity of customers. It allows people to stay in jobs they would otherwise leave. And therefore, many of our employers have had to think about how do they make hybrid working work well and effectively and not reduce productivity. There are also warning signs. This is a survey from the London School of Economics, and they surveyed economists discussing the impact of home working on productivity, job satisfaction, and interestingly and importantly, women's career progression. Because you might argue that women who, on the whole, stayed at home more during COVID, perhaps did not return to the workplace so much, perhaps ended up with more caring responsibilities, have their careers been impacted by COVID and working from home. And you can see the questions that were asked here and whether these economists strongly agreed, uncertain, or disagreed. And you can see that employees who spend 2 of their days each week working from home are likely to report higher job satisfaction in the long term. Well, 60% agree, 9% strongly agree, and 31 uncertain or of this, but none disagreed. But having the opportunity to work 2 or 3 days per week from home, likely to benefit career progression more for women than men. You can see 55% are uncertain, 17% disagree, 2% strongly disagree, and only 1% agree. So I think we have, the jury is still out, and we certainly have challenges. And again, you can look at what's in our major press. Amazon calls staff back to the office 3 days a week. On the contrary, Fortune magazine saying the return to the office could be the real reason for the slump in productivity. And here's the data to prove it. And then I mentioned before this trend to a 4-day week. There's been a definite renewed interest post-COVID. And of course, the proponents would say there are many advantages. Reduced stress, better homework balance, increased productivity. The detractors would say there's some sectors where you can't easily do it. You can't just let doctors off 4 days a week. Who's going to be there on the 5th day? And unless you train many more doctors, you won't have the rotas to do that. The same could be true of education. And what about if you want to go to the theatre are you now going to close your theatres on a Friday? There were some that would argue that you get reduced hours, but you don't get your extra productivity. So trials have certainly been proposed, and there has been one trial recently, the Cambridge trial, where Cambridge social scientists conducted the world's largest trial of a 4-day week. Some people will argue that the methodology here was not as robust as they would have wished, but the findings in this trial was that it reduced stress significantly, it reduced illness, and it helped worker retention. But on the other hand, you can look at the media coverage and reaction, and the Telegraph said, Britain is barely working. Now it wants to work less. We instantly regretted it. Why one company ditched its 4-day work week. This is yet another of our challenges, which has certainly not yet been decided positively or negatively. One of the good things, one of the positive trends, has been the investment in digital structure. And it's certainly been accelerated as a result of COVID-19. The extent to that is yet to be fully determined, but many, many organizations have invested far more and know that investing in digital structures is really important. And many have invested in machine learning and artificial intelligence technology. And then good workplaces and good work. I've mentioned leadership, I've mentioned board level engagement and accountable managers, and that provision of good work. Good work for many people is security, both physically, psychologically, financially. It's having flexibility. It's being given some sense of autonomy and trust. It's about the opportunities for training and career progression. A good workplace pays attention to most physical and mental health improvements, and it empowers employees to care for their own health. We can't think it's the responsibility of our employer to look after our health entirely. We ourselves have many ways in which we can care for and improve our own health. And evaluation, I think, is slowly improving to ensure continuous improvement. And the trend, certainly in the UK, is better employee experience. That is what they want. We have lots of jobs not filled. So if you like, the employee can expect and demand more in many jobs. And they want a great employee experience. They want to feel that their day-to-day experiences are good and that there's good connection between the staff and the organisation. So this has been quite a change within many UK organisations and businesses. But the push and pull factors of why people leave haven't changed much compared with the pre-pandemic time. And you can see there the key factor driving anyone to leave a job, this is 2021 data, is managers' behaviour. Managers matter terribly. And this is taken from our Institute of Employment Studies in one of their papers. They were looking at working from home, transitions and tensions, and they were saying that working from home has exposed managers who lack empathy, have limited interpersonal skills, and are simply not suited to the complex demands post-COVID of people management. And therefore, one needs to support them, develop training curricula that strengthen new people management competencies that the future of work will almost certainly demand. And this is data from the German-speaking part of Switzerland, from an industrial psychologist. It is pre-COVID data. I suspect it might even be more of a significant finding today. About 1,540 managers, medium-sized or small companies. And this author was particularly interested in the health of the manager and the fact that the manager's health, both physical and mental, could and would affect the health of the people they managed. And you can see here there those managers who had never had a health problem. I've not got a physical problem, I've got a psychological problem, or I've got both a physical and a psychological problem. And those managers who had both a physical and psychological problem have a greater negative effect on the health of the people they manage than if they were in robust health themselves. So we must support our managers. So health and well-being has been elevated. And what lots of organizations are asking, what works now? How do I make it work? How do I establish the business case? And this is something that we now need slightly to reinvent post-COVID, because perhaps what works is slightly different, and how you make it work will certainly require some adjustment, and establishing the business case really important for your financial manager. So I wanted to tell you about this really evidence-based wellbeing toolkit. I mentioned before that there has been a growth of the industry of well-being and wellness at work that isn't evidence-based, and we wish to avoid that. So this is findings from a project that was funded by our Economic and Social Research Council. It's taken over 7 years. The last part of it was in the pandemic, and it was bringing together practices and combinations of practices for health and well-being at work. You can see a systematic review of more than 300 scientific studies, 280 interviews, analysis from 100,000 of people and hundreds of organizations. And this research team was quite large. The University of East Anglia leading, Rand Europe working with them, and also researchers from the University of Kent, Swansea, Essex, Reading, and Sheffield. So a really carefully done research project. And what they now have is what's called the Evolve Toolkit. And I would encourage you to have a look at this. It's free, it's evidence-informed, it's workplace wellbeing resources that draw on cutting-edge research, and then you can take action to help your business evolve and thrive in a sustainable way. So you can ask the question, what works? And then how do I put it into practice in my organization? And how indeed do I measure it? Measurement is important. And I bring you here the quote of our Chief Medical Officer for England, Sir Christopher Whitty. He said, safety and occupational diseases have been transformed by the combination of science-led industrial practice and legislation. And that is true when we look at the work of our regulators. He says taking the same scientific approach to testing interventions to promote health and at work could be key to advances in the next decade. We need to measure better in the workplace. So our Institute of Employment Studies has, in response, set up a trials unit. So that brings together expertise from different research perspectives and indeed different disciplines to share best practice. And it will allow people to consider both the conventional trials, the research trials that are blinded and really well controlled, but it also allows understanding and evaluation through interventions that are not of that sort. So it gives a much broader range of interventions that an organisation could use to measure their, what they're putting in. And of course it includes work on randomised controlled trials. Finally, I just want to bring us back to, if you like, 2005. The government at that time wanted to make sure people who were disabled or had chronic conditions were supported. This is a very busy slide, but I wanted to bring to you what that unit for health and work, the cross-government unit, which was set up shortly after my report, has been doing. And all of these interventions, whether it's access to work, disability employment advisors, intense personalised support for very disabled people with complex barriers, they have all arisen in the last few years and are delivered through our Department of Work and Pensions. And then, of course, we've just had a spring budget. And fortunately, that budget has really been concentrating on getting people back into work. So there's a package of measures designed to support people to enter work and extend their working lives. Our benefit system, which we call Universal Credit, is going to have more work coach support and greater work search requirements for many on benefits. For those with chronic health conditions, there's a raft of interventions which will indeed help those who are disabled with chronic conditions. They no longer will have to do what has been a much disliked work capability assessment, and there will be work well partnerships to help people get back into work, and also pension changes which really are helpful to the older worker, and then things for our occupational health community. So that is, for us, has been a good spring budget which has just been published. So let me end by saying we're in a time of change. I like the quote from Eric Hoffer, who says, in times of change, learners, those who are willing to learn, inherit the earth, while the learned, who think they know everything, find themselves beautifully equipped to deal with a world that no longer exists. Many, many countries and organizations are encountering challenges in workforce availability, supply chains, inflation, rising economic inequality, and worsening climate crisis. So we all need to be agile, adaptable, and resilient to create sustainable and inclusive growth. Thank you very much for listening to me. It's a pleasure to have been with you.
Thank you, Professor Black, for sharing your insights on the topic. We've learned a lot from your presentation. I would like to invite you to stay behind to help answer some questions from our audience. So now we would like to invite questions related to our topic. It is wonderful to see such a diverse audience from all around the world, including mainland China, Macau, Japan, Vietnam, and many other countries. Your participation has truly made this webinar a global event. So it looks like we've got some questions from our audience. So Professor Black, are you ready?
Yes.
Okay. So one of our audience asked, the digital mental health platform or programs are emerging, has emerged during the pandemic. What are your views on that? Do you think it can really help employees to get access of mental health support, from anytime, anywhere, Can you share your thoughts with us?
Yes, I do. I wouldn't say it's suitable for everyone. Mm-hmm. So, for example, I can well imagine that the young, who are very digitally enabled and like to use apps, I think they will find it really, really useful. If you're an older worker, it might be a little bit more challenging, and you might prefer a phone conversation or indeed face-to-face. But I do think it's an additional thing in our basket of offers. So yes, a good thing.
Thank you, Professor Black. We also have a second question for you. So how can we get supports from management for the support of well-being programs in the workplace? They often have trouble in visualizing the direct impact of well-being with productivity. May I ask you to share more your thoughts on this?
I think this is a really important question, and one I'm asked a lot, because I understand and realize that in some workplaces, managers are not always so ready to embrace these changes. So I think you have to really build up as much support as you can, if you like, both at the ground level of workers who really, through their organizations, really can see the value of this and really try to make a strong case and use examples of places where it's done well. Because there are examples of organizations that have invested, have organized themselves, and can show that if you do invest, you have happier, more productive workers. They are more loyal to the organization, they're more engaged, and it really is a good thing to do. But I think being able to show an example of that really helps. So creating those examples is important.
Thank you, Professor Black. We have one last question for you. So one of our audience found it very interesting when you talk about the growing occupational health program at work, including the mental health hubs or the mental and well-being guardians. So he would like to ask you to explain more about, like, is there any specific qualification, or what are the specific roles that they would do, like, for the program?
So let's take the well-being guardians. These will be people who sit on the boards of our NHS organisations. They will be the non-executives. So they're outside people. They're not inside marking their own homework. And they are offered induction and training so that they can do this job and work very closely with the Human Resources Department and with the people who are collecting the information about health and well-being. We don't want them to become deep experts, but we want them to be able to understand enough that they can take to the board the important facts of where the health and well-being is within that organisation. Within the mental health hubs, there was and is access to health professionals who are trained in mental health. It may be for counselling, it may be for cognitive behavioural therapy, it may be for focus groups which happened within these mental health hubs, it may be signposting to the apps so that people have a choice of what they participate in. But certainly those mental health hubs would have within them a basket of offers so that an NHS worker could make a choice of what they thought suited them best. But definitely there would be professional people with the right qualifications to do that. And what we often found was that if you could do a short intervention early, so if you like, you were at the preventative end when people are first getting symptoms, that was much better than having to intervene much later.
Thank you, Professor Black, for staying behind to answer questions from our audience. I would like to ask Professor Black to wave to the camera and to say goodbye to our audience.
Well, again, thank you so much. I got a week in Hong Kong, which is wonderful, and I'm hoping to see friends and do some walking, which I like to do when I'm here. So, thank you.
And then, thank you to all our international and local participants for joining us today. We appreciate your contribution to the discussion and hope you found the session valuable. Please stay connected with our council for future events, and we look forward to having you join us again. I will now switch to Chinese for the polling session. 接住落嚟，將
Now we're going to the polling session. You can see on the screen multiple choice question for you. So those with full screen, you may want to minimize the screen up. The screen will be shown on your right-hand side. You have a period of 3 minutes. The question is, which of the following measures can foster occupational health and safety culture? 1. Organizing psychological talks. B. Funding employees to take part in physical activities. C. Providing healthy diet. And D. All of the above. So please be reminded that if you want to collect the certificate for today's attendance, you need to finish this poll, and your time entering and leaving this venue would be proof of your basis for proof of your attendance certificate.
好，剩翻1分鐘時間。
Now we've got 1 minute left. Let me repeat the question again. Which of the following measures can foster occupational health culture? A. Organizing psychological talks. B. Funding staff to join in physical activities. C. Providing healthy diet. D. All of the above. Okay, the polling session is over. The answer is D, all of the above. So once again, let me thank Professor Black, today's speaker, for her participation, and all of you who participated in the online webinar. We hope that you've all learned a lot and understood how the UK had coped with the issue during the pandemic and the effectiveness of their measures. Hope we can all join in enhancing staff's awareness of occupational health and safety. That's the end of today's event. Hope to see you soon. Thank you.